The exercises are evidence-based, and they've been around in the scientific journals with regards to scleroderma treatment for maybe 30 or 40 years or more. The versions we're going to look at were honed in a study probably about 25 years ago, and they're now considered the gold standard best hand exercises. They get the best outcomes and the most chance of getting your movement back or keeping your movement at the same level and it not deteriorating. And hopefully it's about a 5-minute routine, so maybe something you can commit to on a daily basis. You don't need any equipment, so easy to do when you're out and about or waiting for something to happen. You've got a spare 5 minutes to stretch off your fingers, and it can become a habit. We're going to look at all 8 fingers, but as Una very well demonstrated, for some of you it might be 1 or 2 fingers are worse, and they're the ones you really want to stretch regularly. And then you do the whole hand perhaps once a week just to make sure the other fingers are keeping as good as they have been. So you may want to warm up the area first. It could be a microwavable wheat pack, or a flannel in warm water is placed on the hands to loosen them off. It might be you do them after your hot bath, hot shower, so they're loosened off. But there's any way you can do them is useful. Don't feel you have to warm them up before you stretch. And I think Una's telling me through her hands that I've whittled on for too long and we should get straight on to the exercises. And I fully agree. So we're going to stretch off your right hand first, if that's okay, Una. And we're going to look at straightening the fingers as best as we can. As I've said, the best way to stretch is by forcing the finger with the other hand. So hopefully you've got enough hand function to do this. If not, you can ask a family member, a household member or a friend to help you. But starting with your index finger for me, if you could lift up under the pad of the index finger and try and get that finger as straight as possible. Yeah, great. And with all of these stretches, we're holding for 10 seconds. Okay, and then we'll move through to the middle finger next, same routine. Lifting it up and trying to get it as straight as possible. Where are you feeling the stretch there, Una?
Just there, if you can see where it's white.
Yes. Yeah, quite distinct of the stretch under the skin there, isn't it?
Yeah.
But of course, you'll always feel the stretch at the tightest part, which is fine.
Yeah.
Okay, we'll move on to the ring finger next. And again, pushing that up straight as far as we can. And finally, the little finger, same stretch there. Okay, so we'll do the same for the other side. So this time it's the left hand being stretched, the right hand is grabbing hold of the pad of that fingertip and lifting it up as best you can. Yeah, great. So we're going to let Una take herself through that hand and just talk through as you stretch for 10 seconds on each. I'll let you know so we can move on to the next finger now. So Una, you said you've recently seen an occupational therapist for your hands with your scleroderma.
Yes, I'd finally seen one there at the start of May, and she made me molds for my hands so that I can put them on at night time and wear them in bed, you know, hopefully preventing my fingers from curling any further.
Yeah, and I think that's a realistic target, to our goal being let's make sure things don't get worse. But equally, we can improve movements. Normally after the first 18 months is the best time to see movements suddenly come back. And we don't know if that's due to the disease course or the medications you may have started, but first 18 months go slowly. After that period, we can start to see the benefits. Thanks very much, Una. So that's the fingers straightened as far as they can. We're going to do the opposite now. So we're curling. We'll start again on the right hand index finger, curling the finger in as far as you can. So it's almost touching, or if possible, touching the pad of the hand. Now, don't worry if you can't make it touch. It's just trying to get that stretch as close as possible. And for some of you, when you see your rheumatologist, you might have that measured, the distance between the pad of your hand and the tip of your finger. And again, we can see that whitening as the skin is really stretched there on the knuckles, can't we? Okay, that's 10 seconds. Thanks very much, Una. Should we move on to the middle finger next? And we've mentioned your occupational therapist. I should mention, for some places it's the physiotherapist, for others it's the occupational therapist who leads on the hand stretch routine. But we would highly recommend you see those members of the team as soon as possible, really, depending on access in your local centre. We'll move on to the ring finger now. Thanks, Una. Ask your rheumatologist for a referral to your occupational therapist, your hand therapist, or your physiotherapist to have a review of your stretches. And even if your movement's fine, there's no reason you can't see us and get some advice of how we would stretch and kind of keep things ticking over.
Yeah.
And we're on to the little finger now. Thank you very much. Okay, we'll move over to the left hand, and again, starting on the index finger. How are these feeling for you, Una?
They just feel very tight.
Tight is good, painful is not good. So
yeah.
And then we'll do the same on the middle finger. And then on the ring finger. And finally onto the little finger. So that is 8 fingers stretched into full straightening position, full bent position. And then there's one more exercise, and this is the one I always struggle to explain, even though I've been teaching this for many years, is we're trying to curl the finger, but this time it's the knuckle here that we're mainly trying to stretch. So you can let anything from the knuckle downwards go straight. It's this bit we're trying to push down as far as possible. Yeah, perfect. So you'll feel that stretch on the knuckle there. Again, we can see that whitening, Una, on your knuckle there as it's really stretching off. Feeling okay?
Yeah, it actually feels good.
Good. That's what we like to hear. I hope you guys at home are all finding similar response. So, you know, you may be lucky and be seen at a local Scleroderma centre, in which case your physiotherapist or occupational therapist will be well aware of the condition and how we should best manage it. If you work under shared care, or perhaps you're seeing your physiotherapist at the local health centre or occupational therapist at the local health centre, they may be less aware. Please feel free to take them this video or the written instructions of this video and say, look, this is what the research says. This is the best recommendations for stretches. Could you see what you think of them? And part of our role is to educate the health professionals we see. Thank you. Yes, Uli, on the other hand now. Yeah, so part of our role is to educate not only the general public about what scleroderma is and why we desperately need to support it, and also educate healthcare professionals. If they've never heard of it, then don't be too frustrated. Just let them know what you've been taught, and then they can use it for the rest of their career. Okay, moving on to the ring finger, the penultimate exercise of today's session. And then finally that little finger, feeling the stretch on the knuckle. So this is the hand routine that tends to get the best results for the most frequently seen limitations of movement associated with scleroderma in the hands. It doesn't mean they're the best exercises for your particular pair of hands, so do try them. If anything's uncomfortable, or if you're finding tightness elsewhere, maybe at the wrist or the base of the thumb, then seek a referral and get an opinion on how you can stretch them as well. We do know that stretching works, but we do know it has to be a daily habit. So I hope it's enjoyable, maybe not fun, but tolerable, and you feel the benefit from it. And outside of what we've talked to with the hands today, there's also a video in today's session with regards to stretching off the mouth. And if you go on the SR UK website, there's also some resources about stretching off other areas. So it could be you've got skin tightening across your chest, causing some tightness on shoulder movements or your elbows, your wrists, perhaps down into the legs. And any stretches where you can put some extra force through can have good benefit in either maintaining or hopefully improving that movement.